everybody!
Hello!
Welcome to Be Green with Amy. I'm Amy, and today we are with the Dentist Whole Food Plant-Based Lifestyle Meetup! There's also a Plant Cure Communities pod called Southwest Florida Healthy Eating Group, which is also you guys. So, today we are in for a really special treat. We have had so many nice presenters, but today we are having a local plant-based cardiologist return and speak to us. Dr. Dulaney wears many hats. She, of course, is a plant-based cardiologist, and she practices here in Southwest Florida. She's a triathlete. She gardens. She cooks. She has podcasts that you guys have. She has hundreds of podcasts that you guys have to listen to. And now she added something else to her repertoire. She is now a book author. So this is a plant-based wellness cookbook, which is really exciting because we don't have many like this. And you guys have to get one of these because they have some really great recipes. So please help me give a warm welcome to Dr. Dulaney.
It smells very good. So somebody asked me if I'm going to eat, and it's like I like to be the cleanup person so that I can just make sure I have to scrape all those plates clean. So make sure y'all get your second before I get at it. Thank you for having me. As Amy's, I got the first question here. Why, when did I become plant-based? And it was actually a lady in the heart catheterization laboratory. I walked in one day and it was this skinny woman. She was eating this giant salad, and I looked at her and she said, "I'm vegan." And it's like, I'm from West Virginia. I didn't even know what a vegan was. And she said, "Yeah, you got to read this book, A Diet for New America by John Robbins." And how many people have read that? Yeah, a lot of people. So it was by John Robbins is the son of Baskin and Robbins, if you haven't read the book. And for those of you who don't know that Uncle Baskins died of a massive heart attack at age 55. So I read that book and it talked about, the health benefits of being plant-based and the environmental benefits and the animal benefits of being plant-based. And I was convinced right then and there, I'm vegan. When I finished the last page, I'm going to do it. And I assumed because I'm the doctor of the family, all I had to do was tell the rest of the people, and everybody would be vegan then. And it didn't work out that way. They said, just go ahead and have fun. We'll be over here, And so, we went back and forth and back and forth and back and forth for a while. And eventually my parents both became ill. And we used to all eat as a family, my daughter, my parents, and I. And when they became ill, I took over. We used to share the kitchen responsibilities. When they became ill, I took over the kitchen responsibilities. It was kind of a coup. And everybody's plant-based. And so that was kind of how the story. So they the rest of the family went kicking and screaming a little bit. But after a while, everybody, like everybody does here, you adjust and you start to find your what we call go-to meals. And I didn't incorporate it into my cardiology practice at first. I'd say, this is a great way to eat. But and I give them Dean Ornish's book and say, if you can do this, it's great. It's a bit strict, but, it really makes me feel good. And one day I was running, and as Amy said, I do marathons and triathlons, so I always listen to I listen to somebody's podcast when I'm running. I never listen to my own. And I listened to one about forks over knives, and I would guess most people in here have watched that movie. And I heard how Dr. Esselstyn incorporated teaching people in his practice how to cook plant-based and the science behind plant-based eating, and how it was very effective. And so I thought, well, that's what I want to do in my practice. So I started teaching a nutrition course in the evening in the back of my office. And so we had 16 people, and I started out with a whiteboard, and I'd bring, a cooler full of food and, do some sort of a salad prep in front of them and give them a taste. And we met every other week for 6 sessions, and I made people pay in advance so they would show up because I knew, that make them, hold their feet to the fire a little bit. What I noticed very quickly is all of a sudden people started getting better. Their blood pressure, the crowd was shrinking in size as far as their weight. Blood pressure, the people that were in my practice, their blood pressure medicine, we started to take it away, their cholesterol medicine. One day I was talking about diabetic neuropathy, and I saw this guy, do the head, you can see people do the head tilt when all of a sudden the leg clicks, and he said, I haven't had a diabetic foot pain in like 3 weeks. And it's like, oh my goodness. So we went from a class every other week to a class every week for 6 weeks. Then we went to 2 classes on Thursday night. Then we went to another night, and we outgrew the space, and we went to another space. And the only complaint I had was that when the 6 weeks were over and people went out on their merry ways, if they went on a cruise or they went back with family, they would kind of slip back into their old ways and say, we just have this all the time. It would be great. So a year ago in October, we decided to change the practice because this is the first time in my life as a physician that I was actually having success. You know, taking people off of medicine and instead of putting them on medicine. And it was really hard for me to come in and do a heart catheterization on somebody when I knew that there was a better way. And I would talk to them. It's like, again, there's a better way. If we can only do this. And so we decided to change to a membership practice so that every member would have access to the nutrition classes. So we now have 3. So we also tore down a wall in the back of the office and put in a kitchen and made the place a little bit bigger so we could accommodate more people. And now we have 3 nutrition classes a week. And in the meantime, my daughter, being the daughter of a physician who hung around other physicians all the time, she always wanted to, she knew she wanted to help people, but she wasn't sure exactly what kind of a field that she really wanted to go in. And she toyed with being a physician, and I kind of giggled because she was much too creative and had much too much of a personality to sit in a chair all the time and to be a physician. And she was going to be a physical therapist, and she was going to do all these kind of things. And finally, she ended up, when she was in physical therapy, she walked onto the West Virginia University rowing team. And so she's a Division I rower, and they had a sports nutritionist. And so when she started working with the nutritionist, it kind of clicked for her. She was vegan because she was the oddball at West Virginia University, being a vegan athlete. They didn't almost know what to do with her. But this nutritionist, the registered dietitian there, took an interest in her so that they could teach her how to fuel herself for Division I athletics. So it clicked for her, and she became a registered dietitian. So she joined in our practice as well. And the unique thing about it is that in standard medical practices, you would think, I've given lectures to registered dietitian groups. And it's like, you guys hold the key to health because nutrition is everything. And to me, every medical practice should have a registered dietitian. They can't have mine, but they should have somebody else's. And because they can do the most good. But insurance companies and Medicare, they only pay for one visit for 15 minutes quarterly. You can't do anything in that time frame. You can't help anybody. So they're kind of a nice lot, so they say, do the best you can, eat less, and, eat more plants, and that's about as good as it gets. So this gives Addie the opportunity, so we kind of double team people, good cop, bad cop people, work together, and so she works with people, she talks to them one week, I talk to them the next, they're in the office, and then we do this nutrition class. And the other person on this book is, and she couldn't come tonight because she's at Zumba. She missed last week because of rain, so she had to go. But the other person is the diva. And the diva is my mom. She's 86 years old, and she does Zumba once a week, and yoga once a week, and golf's other 2 times a week. And so she's a little Italian lady that once said that you gotta have salt and you gotta have olive oil. And but now she started helping me in nutrition class, and actually her health is turned around, and she's doing very well, and she realizes that you don't need salt and you don't need olive oil, and so at first she said, well, you're gonna have to do, I'm not gonna cook and then she started coming up with recipes, like we always would have soup a couple times a week, so potato soup. So she came up with potato leek soup made plant-based style, and then vegetable soup made plant-based style. And then it's like, well, if we're going to do cabbage rolls, it takes too long to do cabbage rolls, how about doing cabbage unrolled? So she started coming up, I would come home at lunch and she'd say, I got an idea for something tonight. And so she would create recipes, and they were really good. And so we would say, these are our go-to recipes. These don't make this anymore, we won't do this anymore. And so we came up with this repertoire. And we started to say, and then we would, in the nutrition class, I always cook something in front of people, and we tried to introduce people to a new green and a new grain, every week, and combinations, and show people how, especially the level 1, how to get food on the table in 30 minutes or less that was good but not so complicated, so that they wouldn't, be afraid to get back into the kitchen. So between what I cooked at in the class and the go-to meals that we had overnight, people said, and then we do this, the last thing we do this, we go shopping together once every 6 weeks. Anybody that wants to meet me, and actually it's next Thursday, if you want to join in, you can come down and shop with us. But I take people through Publix, and we look at all the different vegetables, what you can do, how you can cook with these, and people would say, you need to make a cookbook. I can't write all these recipes down. So he's like, sure, yeah, I think we will. We have all these recipes, because I would just kind of jot things down and do the recipes, and then I'd have Addie type them up and do the nutrition facts. So it seemed like we had everything already written down. We just needed to put them together, and we'd have a book. And I didn't realize that wasn't quite as easy as it was going to be. And so Addie, in the meantime, moved. She was in Atlanta. And so I was, now we're emailing things back and forth. And so I said, something would happen in the book that would go on the back shelf for a little bit, and we would, then we'd pull it back. And it's like, we got to really get this done. I want it done by our conference this year. We really need to have this done. And so she said, she started looking, she said, this is just a disorganized mess. She said, I don't, so we, finally sat down, and we got our chapters organized of how we actually wanted to do it. And she did all the photography for the cookbook. And so, meanwhile, she marries this guy that's a 220-pound strength coach. And so she's making the food on the table. It's like, we're ready to eat. Oh, no, we're not. We've got to do photos, So every night he had to sit and look at his food until the photos were and he participated in some of the names. Nathan's favorite dish in here is pulled pork, because we don't eat pork, but we eat, so this made with soy curls. So we all kind of participated in some of the names and did the photography, and finally, it came together, and we, I guess we launched at the end of the beginning of June, I believe, beginning of June, July, and it's been a lot of fun. At first, we weren't going to put our mugshots on the cover. There's a local printer in Port Charlotte, Buffalo Graphics. I don't know if anybody's used them. But they're a really good family, and so I sent some photos to Jordan and told him about what we wanted, for kind of some ideas for a cover, and he shot it back. He's like, well, your vegetable photos aren't that great. He said, but I put this on. Do you think, what do you think about it? And, I do the podcast, and so a lot of people know my distinctive soprano voice, and they don't know what my face looks like. And we always tease in nutrition class. We call my mom Little Vanna, because she's, like Vanna White, the assistant, but she's tiny. So, and we weren't sure what we were going to call the book. But if anybody gets to know my mom, Janice, and a couple people here actually know my mom, she certainly is the diva. And so we thought, well, this would be great to get her picture on the cover. Just as a side note, people, we talked about why I became vegan. One of the reasons that I became a physician was my terrible family history. My grandfather died at 48 of heart attack. My grandmother died at 57 of heart disease and diabetes, and my other grandmother died of diabetes and a heart attack. And I actually remember as a child, about your age, riding in the back seat of a car, taking my grandmother to the hospital in heart failure or DKA. And so that kind of led, and that was the 48 and 57 was my mom's parents. And she had three brothers, and they all passed because of heart disease and diabetes. And my mom actually had hypertension and high cholesterol diagnosed in her late 30s, 40s. So we know she has the genetics to have really bad genes. So to me, she's living proof that you don't have to turn your bad genes on. They're there, and they can be controlled. So just because you have perhaps a bad set of cards of your genetics, it doesn't mean that you have to act on it. And you got the one nail in your coffin. It doesn't necessarily have to be that way. So I think that that makes us all the more special that she was able. And then I guess the last story I'll tell about my mother is when I became vegan, the only medical I was starting to get, I started running marathons because my cholesterol was starting to go up in my 40s. Just, eating the standard American diet. I was eating the healthy standard American diet, of course. It was a lean piece of sirloin and, the whatever, and, the cake was only on the pie, was only on Sunday or whatever. But I had, so a little bit of cholesterol issues, and I had indigestion. I started getting reflux. So as any good physician, you just go to the back and you start taking your own medication, right? So I go back and I dose myself with some Lipitor and dose myself with some Prolosic. And so when I went vegan, it's like, well, I'm going to get off these medications. And of course, my cholesterol went down. That was really easy. But this indigestion thing, it wasn't going away. And I thought, well, that's kind of a bummer. I still have this indigestion type of deal. And I was always a big sweet eater, and especially around Christmas. So I would make the vegan cookies, and those vegan cookies with the vegan butter and all that kind of stuff. And so I always get really bad indigestion around Christmas time. I blame it on the extra coffee I drank with my extra cookies. But it turns out it was the oil that was in my cookies that was actually causing most of the problem. And when I decided to give up oil, all of a sudden my indigestion went away, and I was able to give up the Prolosic. Well, my mom was hanging on to her olive oil in her salad or whatever, and she said, well, I went off. She also had the indigestion problems, and she was in her 30s, and she said, I want to get off the oil. And it's like, well, you're going to have to give up she wants to get off the Prolosic, so you're going to have to give up the oil. She's like, really? And it's like, yeah. So here she is at 80, after 50 years of indigestion and bad stomach. She gives up the olive oil, and now she doesn't have any indigestion, so she gets. So, so it just goes to show you that it doesn't matter what age you start this. There's still a tremendous amount of benefits that you can get. And I know people that do triathlon. It's like, I don't have any medical problems. I do triathlon. I'm really good. But then they notice that there are aches and pains. That you recover better from exertion and exercise, and you're not as sore or stiff after workouts. You don't have the little niggles that you had after long. And so everybody sees some benefits. And as an aside, there's a movie coming out in September. I think Amy's posted it several times, but The Game Changers. And if you have any young people that are into athletics, it's a must-see movie, because it showcases men and women that are elite athletes in how plant-based nutrition helps them to train. Because the difference between elite athlete and the goal between the first place and first loser is basically how much you can train. And so if you're not getting sick and you're recovering better from your workouts, then you can train more, and that's really the edge that people get. So I think you'll start to see more and more people becoming plant-based because of athletics after this. And unfortunately, when the pro athletes do something, then a lot of people want to emulate that. So this is actually a good thing that they're doing. A lot of elite athletes. So I think that's a good thing, and I would encourage everybody to see it. It was one of those movies that it was over, and I could have watched it longer. I was really it was very, very entertaining and a good movie. So I'm just going to open it up. Anybody has any questions? Fair game. I'll answer anything, more or less, and I'll mostly tell the truth. Yes.
I'm not sure if this is an area that you feel comfortable discussing, but I had a bone density test recently, and I had osteopenia. Now I have osteoporosis, and the numbers were -2.9 and -2.8. And my doctor wanted me to be on one of the medications, and he knows me well enough that he said, I'm not going to tell you which one to be on. You can choose. I know you're going to go home and research it. And so, but we were talking longer, and I said, okay, if I have to take something, let me just take the one that I take once a year. So then I went home and researched it, and it said you should not take it, that's reclass, you should not take it if you have asthma after having aspirin, which I did. So then they said, okay, take the shot that you take twice a year, and that says not to take it with herbal supplements. So I really don't want to take anything, and I would really like to do it with diet and exercise,
Yes.
and getting out more for more vitamin D, even though I live down here and I have a little dog. Often I wear, longer sleeves. So now I'm going out first thing in the morning in my bathing suit for about 20 minutes. But how do you approach this? Now, I heard Dr. Pam Popper talk recently, and I asked her about this, and she just said, well, the DEXA scan was invented for Merck so that they could sell Fosamax, and she said it's not worth anything, so don't worry about it. So, what do you recommend? And then I have scoliosis, so I can't do a bunch of jumping around. So I know how I would like to treat it, but I don't know how.
Okay. First of all, Pam Popper's right. It was invented by Merck, and it isn't worth much. It was, it did help the sales of Fosamax, which can cause an esophageal rupture. It compares. The DEXA scan has never predicted hip fractures or back fractures in anybody. So it's never been it's like you can tell you have osteopenia or osteoporosis or say that, but it doesn't say who's going to break and who's not going to break. And the best way not to break is not to fall down.
Right, I know.
So that's the starter. So how do you not fall down? Well, you're strong. And you have balance and you exercise, and of course, even people that exercise trip once in a while, but, so the idea is to be strong. We know that after 30 years of age, you start to lose muscle and bone mass, and it starts to go down. And so if you weighed 130 pounds when you were 30, and you weigh 130 pounds now, you're sitting on a lot more fat mass and a lot less bone mass and muscle mass than you were, unless you've done a lot of athletics. And it's not we want weight-bearing exercise, so it doesn't have to be jumping up and down necessarily, but at least a good, strong, vigorous walk and some strength training. And even people with scoliosis, the best way to not make that get any worse is to have strong bones and to have strong muscles supporting those bones. So really the crux of it is eat plant-based. And we also know that people that eat plant-based lose less muscle and bone mass than people that eat animal proteins, because when you eat animal proteins, you're dragging calcium out of your bones to try to neutralize things a lot, so that those people are more osteoporotic. If you look at places in the world where people have the most osteoporosis, it tends to be Great Britain, Norway, United States, where we eat the most calcium, where we eat the most dairy, where we eat the most animal protein. So if we're doing such a good job at eating, and we have, if you go to CVS and you go into any store, it's lined with calcium supplements, vitamin D supplements. And so if we're doing such a great job at all this, then why are all these supplements on the shelf if you can get them from all the milk? I mean, if you went out to a restaurant, I would challenge you to find something on the menu that didn't have cheese. So we know everybody is exposed to dairy. So if it works so well, then why are so many people have osteoporosis? It's because again, the acidity that's caused with this leaches the calcium out of the bone, and you really don't even absorb the calcium in dairy so much. The other thing is vitamin D and the sun. Taking a vitamin D supplement, and even if you take the supplement and your levels went from, well, first of all, the level that was normal has been increased. And that there's a whole lab little shenanigans going on in that area too. The guy that was tied to changing what's the normal vitamin D levels also tied to vitamin D lab testing and so forth. So the normal level now is 30. It used to be 18. So now we have this group. And of course, does anybody in this room know anybody with rickets? No. So that's the vitamin D deficiency, really, is rickets, and nobody has rickets. So we've gone all these years, but now all of a sudden people have seen observational studies that people that have cancer have low vitamin D levels. People that have diabetes have lower vitamin D levels. So it must be the vitamin D that's causing the disease. So if we give people the vitamin D back, then the disease will go away. Well, that's never been shown. That doesn't work out. It's an association, but it turns out if you go into the hospital with a blood glucose of 400 and your vitamin D's level is low, and they correct your glucose while you sit there and they repeat your vitamin D level, your vitamin D level goes back up. So they didn't give you vitamin D, it just miraculously, when your glucose got better, your vitamin D kind of shifted around. It's just the metabolites and how it's bound and things. So taking vitamin D, so if you have a low vitamin D and you take the supplement, it still doesn't prevent people from getting fractures. It doesn't predict one way or the other. If we go out in the sun and get our vitamin D, your level still might be a little bit on the lowish side, but it's okay for you if you're healthy and you're not, and so that's really been the only way, and you have to activate it. So it turns out if you eat green vegetables, and if you've ever put a flashlight on your skin and you can see the you can see it shine through the capillaries, well, it turns out when the sun activates the chlorophyll in your skin and you have in the vitamin D, that actually activates things. So you got to go out in the sun. We become sun phobia. This phobia of getting skin cancer has been drilled into people's minds so much that people are afraid to go out into the sun. And the reality of it is, to get a cancer, it's kind of a trifecta of any kind. People just don't get lung cancer. They usually have to have some sort of toxic exposure, and they have to have something that drives the growth of the cell. So the things have to kind of go together to get cancers. The perfect storm, the diet and genetics or whatever. So skin cancer is kind of the same thing. If you have poor dietary habits and your immune system is weak and you go out and get fried, then you might have an increased risk of skin cancer. But just going out in the sun is not going to turn everybody into a raging melanoma. So I think that in most of the sunscreens don't do that much for melanomas anyway. They may prevent some basals or some squamous cell cancers, and those never really killed anybody anyway as far as the skin. So we need to go back to what we were supposed to do. As humans, we were meant to be outside. We weren't meant to hide inside in dark quarters all of the time, be in front of a computer screen. So I guess the long and the short answer is go outside and a pound of pavement and garden and pick up things. You can pick up your gardening tools or a thing of mulch just as well as weights, but move. And no, I wouldn't take or recommend those supplements at all anyway.
Thank you.
Mm-hmm.
Thank you.
Oh, that shut them up. Yes.
Do you have any recommendations for someone who's eating meat, plant-based, have been for 5 years, and no nuts, no avocados, no coconut, and still 200 cholesterol?
There is a set normal. When we do some blood tests on people, some people actually can make cholesterol pretty good given the right substrate. There is fat in some things that it's impossible to eat a zero fat diet, nor would we want you to. We have to have our omega-3s and eat flaxseed and some people are just really good at absorbing and their livers are really good at making cholesterol. Our livers typically make about 250 milligrams of cholesterol a day, and that's kind of what we need for cell walls and brain function, all that kind of stuff. So we don't ever need to take any in. But sometimes our system can be ramped up. The other thing that happens is, and if it's not being oxidized, then it's kind of not slipping under the rug. So it's not as dangerous if you're eating well. But the other thing that I think is important, you've been plant-based for 5 years. You probably haven't been perfect for 5 years because nobody is. We all have that journey. And when you were 15 or 20, you didn't eat this way. If a 7-year-old eats a box of donuts and a Big Mac, their cholesterol's not going to be high most of the time. If they do it on a recurrent basis, and not. But I mean, for the most part, 20-year-old, you don't see high cholesterol in 20-year-olds. And now, I mean, we're kind of screwing everything up. But a normal, and the reason is that they haven't had time to accumulate it. So I like to think about cholesterol as almost being more of a marker. You know, you have these, you were born with a storage unit called your body. And you take it in and take it, and some people have more storage units than others. And so high cholesterol is somewhat of a reflection of how much you've stored and how much is kind of spewing out into the street from your storage unit. And so it takes some people a long time to kind of get rid of it. So I've seen people that, some people are really lucky. They were the cheese at McDonald's eating people that, turned their, 3 months later, my cholesterol was 150. Look at me. Well, they probably didn't store cholesterol as much as somebody that has. Then there's other people that are 230, 220, 210, 210, 208, 209, 208, and then they finally drop. So, and you can see as people lose weight, sometimes their cholesterol even goes up. Because again, when you get rid of fat, you're also getting rid of what was stored along with it. So it can still come out. So sometimes it just takes longer. So be patient. Hold the fort. Know what that you're taking in. You're not hurting yourself, and you're not oxidizing. You're not lighting any of these fires. You may have some embers in there, but as long as you don't light the match, you're not going to start a fire. Yes.
So I'd like to hear you share about, you're unique in this, because I've researched around, to find plant-based doctors, because I've been living this way for a really long time, and I usually consult with some of these doctors that have written the books and whatever, and I wanted to have somebody, one person follow me here, with all the different things, because I was very ill 45 years ago, and, there are no I found one functional sort of, that's the title, functional medicine doctor in Bradenton. And then I asked the question, well, is she plant-based? Well, plant-based? She eats fish, meat, and I'm thinking, what is your experience with, you're like an entity of your own. Where are there other, how do you communicate in this medical field? You know what I'm saying?
Luckily, I was born an only child, so I learned to play by myself. And I think that, in some respects, I guess I experiment on myself, and I see what's around me, and I've had the pleasure of speaking with, Dr. Esselstyn and Dr. McDougall on a regular basis, about, when I was afraid when I first started this, because as a physician, if I say, hey, you should go play, we don't want to do that work catheterization on you. You just go eat kale 4 times a day, and you don't have to have it. You'll be all right. And you say, yeah, okay, I'll do that. And so as you're driving down the road, you're just like, oh, there's a McDonald's, we should pull in. And you say you're going to eat the kale, but really you're eating the Cheez-Its and all that the cheeseburgers and all this other kind of stuff. And you have your heart attack. And your family's like, what happened? So I went to the doctor and I tried to have them help me, and they told me, and I've been doing exactly what they said I should do, and I've been eating this plant-based stuff. Well, we need to get you a good lawyer, because that's a quack, and so you don't have a leg to stand on, and that's the fear-based medicine that most people practice. And I gotta tell you, when I first started doing this, before we actually transitioned to practice, I would just talk to people, and I say, you should, eat this way, and I try to give them the whole spiel, in the 40 minutes or whatever, and they come back in, and maybe they hadn't lost any weight, maybe their cholesterol was still a little bit high, and maybe they were having some chest pain. It's like, oh God, maybe this just doesn't work for everybody. And what happens if Esselstyn's really a fraud? Did I fall for this? And because I met the guy, and he looked healthy, and I met Goldhammer, they looked healthy, but maybe they're just frauds, and I'm the only guy that's really fallen for this. Nobody else is doing it, And so I call him up on the phone and I said, listen, Dr. Esselstyn, I got this guy. And he says he's eating no oil, no meat, and he's still having chest pain. And he says, is he fat? I said, well, and he says, does he eat out? I said, yeah, only once a week, He's like, well, he's cheating. And he's like, or whatever. We will say, just tell him that, and then he would go through the whole, I'd have to sit and listen to Dr. Esselstyn tell me, all that. We'd go through it again. It's like, okay, go back and we'll try it again. And you really start, so as I started to do this more and more, crazy things started to happen. you know, I got a consult with a guy with rheumatoid arthritis, and I go into his hospital room, and you know, he's walks with a cane, his legs were swollen, his skin was a mess for all the prednisone and all the arthritic medicines that he's on, and his fingers were all bent from the changes that he had, arthritic changes he had for years and years and years of arthritis. And I said, listen, I don't know. I said, if you can, this is a great way to go if you can, do this. And he's like, oh, we'll try it. I'm miserable, And so he and his wife came back in the office. And he wasn't losing much weight. And it's like, I was like, so, when he's getting a little bit better, he's still not, and it's like, well, what do you, he's like, well, I said, I'm eating a vegetable, doc, just like you told me. I put them on a big tray, and I put the oil on, and he did it like this, so it wasn't even this, the people that, it was this, and it's like, I was like, I got it now. It's like, so we got to stop it, and the guy, fast forward, 40 pounds later, Tylee's on the floor, no cane, no nothing, everything went, and so things like that started to happen. A lady walked in, and she had cardiomyopathy. And that's when your heart muscle just all of a sudden doesn't contract for some reason. And hers was related to amyloidosis that she had. And she had amyloidosis is a cancer of white blood cells that are in abnormal cells that start to take off, and it can infiltrate. It causes kidney failure, it causes liver failure, it causes heart failure because these amyloid fibrils actually infiltrate the heart muscle. So they've given her chemotherapy, and she's in heart failure now. She comes in, she says, listen, doc, she says, I'm 70 years old. And I don't want any more chemotherapy, and I don't want to do any of these experimental things. And I just kind of like to, live out the way I can. If I'm ready to go, if this is how it's got to be. But, what can you, if you have anything for my heart to make me breathe a little bit easier, fine. But I'm not looking for any miracles. I said, well, I don't know if this will work. I said, but, have you ever tried like 2 weeks of just being, plant-based vegan? She says, oh, my daughter's vegan. And it's like, well, then could you try it for 2 weeks just to see if you feel any better with your breathing and all this other kind of stuff? And, we went through a thing. Well, she came back in. She was feeling good. She was not in heart failure anymore. And she was starting, and she's, of course, she went to see her oncologist about a month later. She's still doing good. Oncologist said, I don't know. She said, what are you doing? She says, I'm vegan. And the oncologist says, oh, I hate broccoli. And that was her response, I hate broccoli. And then she said, what about these experimental protocols that we've been talking about? And she said, no, I don't want any more of that stuff on. I'm just going to ride this out. If this works great, And she said, so the next thing lady knew, she got fired from her oncologist because she was not compliant, not doing the treatment. Well, 2 years later, this lady's still doing fine, and she's, 3 years later, this lady's still doing fine, and she's eating plant-based. And every once in a while, she'd have a little slip, and she'd have a little bit of heart failure, and, we get her back on. It's like, you gotta get back, I know, and so it's amazing things like that started to happen. So it gave me courage to continue, and I could never really look back. So it doesn't matter to me what, and now some of my members who have lung doctors or go to their endocrinologist miraculously off their insulin for the first time in 25 years, it's like they can't argue with success. You can't argue with the normal hemoglobin A1C. You can't argue with a 40-pound weight loss and now you can breathe in your pulmonary function scores. And so it's like, it's pretty good if you can hang on. If you can hang on, it won't last if you can hang on. So, but they're starting to, ask questions. I actually had a primary care physician join the practice, and his family. They said to support their sister-in-law who had diabetes, but nevertheless, they're all in. So people are starting to, if you go in the doctor's lounge, you see people that are sick. Doctors live less, they don't live as long as regular people because, we do all the bad things as well, and don't even treat ourselves right half the time. But it comes from so it's starting. People are starting to not be as Dulaney's she's lost it. She can't make it any other way, and this is how she's doing. I did have a patient that fell down and was in the hospital. One of my older patients, and I went in to see him, and I walked past the doctor's dictation room, and I said hi to one of the doctors I hadn't seen in 6 months, and he's like, "You're back." And I was like, just visiting, just in. Because they think that, I'll come to my senses. But I hope they come to their senses. We do more than nutrition. Sometimes you need real medicine. You need antibiotics if you've got strep throat or you have pneumonia. You know, vegans do get sick. Vegans do pull hamstrings, and vegans get ear infections from swimming. And so, you know, sometimes you need regular medicine, and we do that. But the other things that vegans don't do sometimes is actually move. And you can eat the perfect diet, but if you sit in a chair all day, you're going to crumble. You know, just like you won't become Arnold Schwarzenegger if you eat 6 steaks a day and you don't lift weights. If you don't move, your body will deteriorate. You know, you have joints that all need to move, and if they stay, you know, if you can have a Ferrari and sit it in the garage, and the tires are going to go, you know, the pumps are going to rust and things are going to get clogged. So everybody needs to be taken out and have their engine revved. And so part of what we do is assess people's motion. Can you get off the ground? You know, can you do a push-up? Do your shoulders work? Do your hips work? You know, if you sit in the computer, do computer work all day long and your hip flexors are all tight, it throws your back out. You know, does your knee hurt because your hips out or your ankles out? So we look at people's mobility and we encourage them to move. And we actually have wellness challenges every month in the office. And speaking of that, you too can join the August Wellness Challenge. So if you're on Facebook, if you're not opposed, Jamila Dulaney, MD, my professional Facebook page, we are doing the month of August birthday challenge, because my birthday is in August. And so we're going to do every week, have people post their exercise log. So if you go out and run for an hour and take a picture of your Fitbit or whatever, and you post it on my website, you join. Then the end of the month, we're going to see the winner's going to get a free cookbook, and we're going to have everybody go into a drawing to have 2 free nutrition consults with Addie. And if you don't want them, you can give them away to somebody that you do want to have them. So we want to participate, encourage everybody to participate. So if you sign up, you get a shirt. And and if you don't, it's like, I don't know what to do, we'll even send you what to do for that week. So if you say, hey, I want to, so we'll send you an exercise, do this, and so you can, amass an exercise program for yourself in the month of August. So if you want to play with us, we'd love to have you do it. You don't have to be a member of the practice. That's me.
And the dog.
And the dog, Samantha. Yes.
I don't tolerate beans well. I can eat small portions every now and then. Do I have to eat beans?
Yes. Typically, over time, people can become more tolerant, and some beans you may be more tolerant than others.
Yes.
So you certainly don't have to eat all the varieties. I have found that cooking the beans in an instant, so making sure they're soaked in, cooking them in an instant pot so they're really soft, helps with digestion. So a little bit of that over time helps the people to get the beans in. But you can still get plenty of protein in from grains, quinoa. So you need can you eat peas?
I can eat peas and butter beans.
Yeah. So you can so you can get your nutrition in through that way.
I'm less tolerant of beans over time.
Yeah, and it's hard to tell what that, sometimes it takes a little bit of diving into your, what your nutrition log is to figure out what's kind of irritating. Sometimes starting from scratch, we take people back with their nutrition and, we'll start on a pretty simple diet and then make sure everybody's things kind of settle down and then reintroduce things and that helps to reset. Because your gut can kind of get messed up with your microbes and different things, and become a little bit less tolerant.
So do you think a log, would you write it down, or is there an app that you would recommend for a log?
Well, we have Addie actually my daughter actually we have a log that we have people keep on their nutrition. And then she goes over it with them, and we kind of just, but you can just get a diary and just write it down. And and kind of put and then make some notes on the side, good day, bad day, and because sometimes it could be a combination.
Yes.
20% of the people are allergic to onions and they don't know it, and can actually cause a lot of GI distress and binding and all kinds of abdominal pain. And so something else perhaps something else or a combination of is causing the intolerance. Yes.
How do you feel about all these injections they're always trying to give us with pneumonia and shingles and flu and all that? I turn them all down, and they're looking at me like,
They make a lot of money for the guy on the other side of the needle. But, you know, so it becomes down to it's probably the most dangerous for the people that need them the most. You know, so immunocompromised people are they're the people that can't afford to get an infection. And, you know, those are the people that is maybe as risky. So it becomes a tough thing to transverse. I don't get any of the injections. I did get the flu in January, and I was, you know, down for the count for 4 days, but, you know, I bounced back and, you know, are stronger because of it, I guess. You know, I kind of kicked myself. I missed a race because of it. It's like, well, maybe I should have got the flu shot, you know, as I'm sitting there. But the reality of it is I didn't want Guillain-Barré either. So, you know, I mean, so the side effects of some of them. So, you know, like I said, we can get sick if you're exposed to enough bad people in a small enough area. You can pick up something, and, you know, but most of the time, if you're healthy and you're eating good and a variety of vegetables and fruits, you can bounce back from it. You know who has the best gut diversity? Like microbes, you know, like population.
Which one?
The Amish, garden food. You know, out, you know, so, but, you know, so we talked about 40 fruits if you can look at your plate. So another thing to look at is, you know, how many different fruits and vegetables do you eat in a week? How many different ones? You know, yes.
What's your experience with IBS or a suggestion? Even no diverticulitis, but there's symptoms of not eating any kind of seeds.
Well, certainly see that diverticulitis, losis, and seeds and nuts, there's really no good data on that. There's one study that everybody gravitated, and of course people that get diverticular disease are not the people that take nuts and seeds, they're the people that take the other stuff. But nuts and seeds won't make that worse. Irritable bowel syndrome, it's kind of a lump. We don't, you know, it's kind of one of those lumpy diagnoses that you get belly pain after you eat and we're not sure why, so this is what you must have. So it kind of has to be teased out. A lot of people will go, well, it must be gluten and wheat products, and that's your problem. Sometimes it could, you know, like I said, we found onions to be an issue in people that nobody thought that would ever be a thing. So there are certain foods that may trigger people that have had a big antibiotic exposure as a younger person. Can have gut flora that is really, I guess not very diverse, and so those people, you know, can have have flares with certain things. So it kind of comes down to really sitting down with somebody and looking at what they're eating and what they've tried and trying to sort it all out. But obviously giving up animal products and dairy is the first thing. Most people get the most benefit from eliminating of dairy as of anything, because it really is going to trigger, that's a completely foreign protein that you're going to absorb. Most people can't digest lactose, you know, and if they can, it's just a little bit. So you absorb that protein full, and so that kind of turns on your immune system and gets things going. So that would be the first thing I would say to get rid of dairy and animal products, and then go from there. Yes.
how do you feel about probiotics and prebiotics?
You know, again, there's a ton of them on the concept is good. But again, there's no, you know, just like there's no FDA approved miracle drug to fix things, there's really no non-FDA approved supplement that fixes things. And if you eat a bad diet and you try to take a probiotic, it's probably not going to do much for you. You know, you can't plant a tomato plant in the middle of the sidewalk and make it grow. Although I do have one growing out of, but I have one growing nicely out of compost that we planted a tree. You know, but. So that's one thing. So you have to feed the bacteria a high fiber diet to make any of the gut flora grow. And then most of the probiotics, the lactobacillus, they're really not the ones that are found in your colon. They're ones that will survive theoretically the production, but most of them get destroyed in the acid of your stomach. What you do end up absorbing is some of their byproducts that can feed your own gut flora. So again, eating a diverse vegetables and fiber, and then perhaps having in an acute situation, if you've had to have antibiotics and you take the probiotics, then that can help. Certainly fermented foods, I think, you know, that's going to give you fiber, the fermentation, so sauerkrauts and things along those lines are good. So I think that those are all good. So I kind of like to go, in the practice, the only thing we recommend for people to take is a B12, and otherwise eat it. And I think you have the best chance. Yeah.
So I would like to hear what you think about bioidentical hormones and the product called DIM.
Hormones are hormone.
Bioidentical.
Bioidentical. They weren't even FDA approved, or and as far as if you look at some of the studies done on what's actually in them, they've not found to be true. If you look at maybe the best ones, you still have a hormone. So let's just take the reason why you take a hormone anyway.
Can I ask you a question before you answer that? I'd like to go along with that. Like, when I was tested 4 years ago, and my hormones, I was told by the solicitor very low. Okay, so I've been taking these treatments for 4 years, and then, I'd like to know, like, in whatever you were gonna also say, is like, how valid are those tests?
Right, so FSH and LH and hormone levels vary according to your cortisol levels, according to your binding proteins, you're like shooting in the dark trying to measure some of these levels to start with, especially in a non-menstruating female, that does, you don't have a cycle so much to be able to really kick these. The hormone axis, we have a hypothalamus that stimulates the end organ. So our hypothalamus secretes thyroid stimulating hormone. It tells our thyroid to make thyroid hormone. We secrete hormones from our hypothalamus, tells our ovaries to make estrogen or to make testosterone. So there are all these feedback loops. But what we do know is that after menopause, the estrogen levels of the production of the ovaries goes down. And with that, we know that endothelial function is not as good. Skin turgor is not as good. There's a lot of things that aren't as good. However, when we did, and I was actually involved in a grant that we gave estrogen back to. And what happens is when we give that hormone, all of a sudden we're stimulating cells that maybe shouldn't be growing to grow. So the result was increased breast cancer, increased ovarian cancer, increased uterine cancer. Estrogen's estrogen, a growth hormone of any kind. So estrogen is growth, right? So the part of estrogen is to make things grow and turn over. What grows and turns over in an adult is cancer cells.
So this product DIM, is that was told to take, because that's the only thing I take besides B12, was, you might want to explain what DIM is, because you probably.
I don't know.
Oh, it's a supplement that's a cruciferous, high potency cruciferous, that's given when you're taking a hormone to counteract the possibility of it.
Oh, well, that is beyond hokey pokey.
So.
Because it's like, okay, here, you should eat this broccoli because I'm going to give you something that's probably going to cause cancer. So good luck. Here, take this. It's like wearing bring your umbrella.
I've been like, it's going down. Dr. Furman is someone that I talk to on a regular basis, and he has told me get off of it. So
I wouldn't. You couldn't chase me down and make me take that, because again, so there are things that same way. So now we're doing it with, we know estrogen causes breast cancer, or increases your risk of breast cancer, uterine cancer, and ovarian cancer. No, hands down. You can give somebody progesterone, you still don't get rid of those, and then the next thing we do is cause people to have heart attacks because we're causing more clotting. So there's only all the studies were done with estrogen, no matter what you call it, bioidentical, horse estrogen, cow estrogen, whatever, it's still estrogen, and it increases the risk of clotting and heart attacks in women. And all those studies were stopped prematurely because, great things, your skin might look great, but you had a heart attack, or your skin might look great, but you got to have, chemotherapy, and then it's not going to look so great. And now we're doing it with men. There has never been one study, and there's actually a good website called farmedout.com, and it's PHARMED out.com. And they actually review, it's out of Georgetown University, and they actually review the medical literature on some of the on medications and what actual studies have shown something and what haven't. And so the data on testosterone because now we're giving it to men. You know, do you feel tired and sluggish? You know, would you like to take a nap in the afternoon? You know, do you wish you had more hair? Do you, I mean, all these crazy things that most people are going to say yes to. And so, have you ever had to take it? Have you ever felt tired? You know, have you ever had a restless night? Well, this is the truth. You must have low T. So we'll check your, by gummy, you do. So we're going to give you, because now what we're going to do, we're going to cause men to have prostate cancer and men to have, these events. And there's actually a black box warning with testosterone replacement that says increased risk of heart attacks. But nobody seems to talk about it because I can give you this gel and you can give me a check.
And keep your granddaughter.
Unfortunately, yes.
What is CoQ10 and why do people say they have to have it? They have to do something else,
So when you give a statin for your cholesterol,
Right.
it blocks the production of CoQ10 and it has to do with some electrical transport, especially in the heart and rhythm problems. So people take a statin and they have the block production of activation of CoQ10. Then this actually might help some of the side effects of the statin therapy. On the other hand, you can go outside and activate it too with, eating greens will activate it as well. But just to take it to
I can't take statins. I'd rather die than take statins. I mean, it was awful experience.
it's a good way to get diabetes.
What do you think of essential oils or homeopathy for using?
Well, I don't know a lot about essential oils other than they certainly do have some benefits in people. Again, there's not probably a cure. If somebody tells you that something fixes everything other than plants, it probably doesn't. But I know if I have a headache and I put peppermint oil on my temples, my headache goes away. It does, and it's really not. There's not much side effects to it. A little lavender can. So there's. So there are people that. There are some things that it will certainly help with. And I don't think that. And I always look at the risk versus benefits. So a little lavender oil or oregano oil or something like that. There's probably not much downside to it. I don't think. On the other hand, if we go all the way to a hormone, then yeah, there is a downside to it. If we go to an osteoporosis drug, there isn't. Just listen to the 5 minutes after you watch a drug ad on TV. The 5 minutes if you have blah 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 and it causes this and blah 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 blah. And then the next thing, then the lawyer comes on the next ad. So, and that's the thing with people they poo-poo eating plant-based is there's not been a randomized placebo-controlled trial of 50,000 people saying that this actually is going to work. So why should I do it? What's the downside? What is the downside of eating a big salad and 5 or 6 pieces of fruit a day and a colorful plate? There's not a side effect to it. Regular bowel movements, weight loss. There's not a side. Will it make you live to be 125? I don't know. Probably not. Maybe, but chances are. But there's not a downside to it. So it can't hurt. It might help, and really I've seen it help a lot.
Well, I think the only downside is people ask you where you get your protein. That's crazy.
Yeah, I always said, it's like, the horses are just keeling over in the pastures maybe from osteoporosis and the cows, and, they can't run it all. Yes?
I have another question. But it's so great to meet a doctor who works this way and practices this way. Have you run across any patients or clients or whatever that have problems sleeping? Because I eat healthy, I exercise every day very vigorously. Maybe it's my age, I don't know, but I do not sleep well, and it affects my energy a lot.
Some people, have always had trouble with sleeping, and it kind of gets worse as people get older. I think actually people require a little less sleep than as we do get older. But then there's this thing, if you wake up in the middle of the night and you start thinking about the grocery list and, so-and-so, and I got to remember to call this person, and you then you go into, the next thing you know, you're solving the world's problem, or you're wondering about things, and you kind of get that, I always call it monkey brain, you start thinking of 1,000 different things, and it just keeps, and then all of a sudden you're just really wide awake. And then you start doing that a couple nights in a row, or in a couple months in a row, and it kind of becomes a habit. You can set your watch by the time you wake up. It's a miracle. It's a miracle. 2:10. Every night. This is where I am. And then you start to fear 2:10 every night because this is what's going to happen. So I think that's where breath work comes in and a lot of meditation and trying to get that to, and then just to stop. And then, good practices, you want to take the sleep hygiene, not watching TV, not having a podcast, even if it's mine plugged into your ear when you go to sleep. And,
You don't have one word to put me to sleep.
yeah, I think all of them will. I really we sit, a lot of them, probably over 70% of them is just me talking. And I have a cat and I have 2 dogs. Occasionally the dog barks and the cat will sit, and I kind of just talk to the cat as I'm, doing this podcast by myself. And so sometimes I'm really not sure if anybody, and then I'll have people, in strange places come up and it's like, oh, I listen, and it's like, how, I listen to the podcast and it's like, really? It's like, I just thought I was practicing talking, So we're gonna, Amy, you're gonna do a raffle? What you got?
Yes,
There's
I've
your-
been listening the whole time.
So we're gonna raffle a cookbook off, and if you lose, you can still buy one.
Well, I would like to, everybody please give it a round of applause. That was awesome. I'm glad that all of you came here to be present for this. We're saying hey to all the Northerners who are going to come back and later and wish that they were here now. Sorry, guys. Maybe Dr. Dulaney will come back
Sure.
when you guys come back. And in the meantime, right here is a subscribe button. Click it so that you'll get notifications when awesome YouTube videos like this one come out and you won't miss out. And we are going to put the information that Dr. Dulaney spoke about, including a link to her awesome cookbook. We're going to put all that in the show notes below. We're also going to put a link to Dr. Dulaney's website where you can find her podcasts. And like she said, she does talk to her cat, but she's interviewed a lot of plant-based doctors. and so there's a lot of great podcasts that I enjoy. So I'm, right, you guys? A lot of people here listening to them as well. So, please continue to subscribe. Let us know if you made any recipes for this wonderful book. Tell us about that in the comments below. And until we see you again,